For thousands of years, there's been this silent, microscopic assassin that has stalked humanity, causing two of our most ancient and feared diseases. Today, we are putting this killer right under the microscope. We're diving deep into the world of Mycobacteria.
So what's its secret? How can a simple microscopic rod be one of the deadliest killers in all of human history? It's a great question, right? And the answer is pretty complex. Because this isn't just any old bacterium. Oh no, it's a master of disguise, it's a living fortress, and it's an expert at waging war right inside our own bodies. So how on earth does it do it?
Okay, first things first, let's meet the family. You've got the two main culprits here, Mycobacterium tuberculosis, that's the agent behind the dreaded consumption, and Mycobacterium leprae, the cause of leprosy. These things are ancient foes of ours, and they all share a very specific set of skills that makes them just so incredibly formidable.
So what are they, technically speaking? Well, they're rod-shaped bacteria, and they absolutely need oxygen to survive. That's the obligate aerobic part. They can't swim around, they don't form protective spores. Really, their power isn't in what they have, but in what they're made of.
All right, every great villain has their signature gear, right? Their armor, their weapons, and this is where Mycobacteria really shine. We're about to break down the biological hardware that makes them so incredibly tough to defeat.
The whole thing starts with its cell wall. It's this incredibly complex matrix built on a strong mesh of peptidoglycan for support. But the real kicker, the thing that makes all the difference, is that over 60% of it is made of these waxy things called mycolic acids. This isn't just a wall, it's a fortress. And that waxy coat? It's literally like a biological suit of armor. It's so effective, it can just shrug off common disinfectants. And even more importantly, it helps the bacteria hide from and resist attacks by our own immune system. This waxy defense is the signature move for the whole family.
But hey, it's not all about defense, right? Mycobacteria have an arsenal of weapons too. There's something called cord factor, which forces them to grow in these menacing snake-like cords. Then you've got molecular tools like LAM, which basically calms down the immune cells that try to eat it, and ERP, which acts like a tiny saboteur, preventing our cells from destroying the invader once it's inside.
So now that we've seen the gear, let's look at how this whole invasion plays out. We're going to focus on the most famous member of the family, M. tuberculosis, and its attack strategy, which almost always starts with a single breath. The attack begins when someone breathes in these tiny airborne droplets, maybe with just a handful of bacteria. They travel deep into the lungs to the little air sacs called alveoli. Now our immune cells, these macrophages, they rush in to eat them up. But thanks to that waxy armor and those weapons we just talked about, the bacteria actually survive inside our own immune cells. So the body's last resort, it builds a wall, a prison around the infected cells, creating this little hard nodule called a tubercle.
And this whole battle leads to two very different outcomes. In most people, the bacteria are successfully locked away. We call this latent TB. Think of it like a sleeping dragon. You're infected, sure, but you're not sick, and you can't spread it. But if your immune system ever gets weaker, those prison walls can crumble. The dragon awakens. That's active TB. And now the person is sick and highly contagious.
And when that dragon wakes up, well, the signs are classic, and honestly, they're devastating. A cough that just will not go away, fever and drenching night sweats, a wasting away of the body with severe weight loss. In the worst cases, people start coughing up blood and get these huge swollen lymph nodes.
But we don't just sit back and take it. For the last century, we have been developing some pretty sophisticated tools to hunt down and fight this invader. So how do we find and defeat this waxy little superbug?
We've got a whole toolkit. There's the classic skin test, which basically just checks if your immune system has ever seen TB before. Then there's the AFB smear, a special staining technique. But the gold standard has always been culturing it, actually growing the bacteria in a lab. The only problem? Look at that. It takes 6 to 8 weeks. Thankfully, modern DNA tests are giving us much faster answers these days.
And that AFB smear I just mentioned? Here's the cool part. It all comes back to that waxy armor. That coat is so tough that when you stain it with a red dye, it won't let go, even when you wash it with acid. That is exactly where the name acid fast comes from. It's a direct result of its own defenses.
Okay, but here's where the story takes a turn, a really scary one actually. We have drugs to fight TB, but this is an evolutionary arms race, and the bacteria are fighting back, developing resistance and turning into even stronger superbugs.
Just look at this progression. It's like leveling up a video game boss in the worst possible way. It starts with multi-drug-resistant TB, or MDR-TB, which knocks out our two best drugs. From there, it can escalate to extensively drug-resistant, or XDR-TB, all the way up to TDR, totally drug-resistant TB, which, yes, is resistant to every single drug we have. Each step makes treatment longer, more toxic, and way less likely to work.
And you might be wondering, how does this even happen? Well, a big part of it comes down to how we treat it. Our standard defense is a cocktail of drugs, especially two called isoniazid and rifampin, and you have to take them for at least 6 months. That long, difficult regimen is tough for people to finish, and every missed dose gives the bacteria a perfect chance to survive and develop resistance to those very drugs.
But I don't want to leave you with all doom and gloom, because there's some really good news in all of this. Check out this number, 90%. For normal, regular TB, if a patient takes their full course of medication, exactly as prescribed, the cure rate is an amazing 90%. Our weapons absolutely work, as long as the bacteria's armor hasn't evolved to deflect them.
And you know, while we've been zeroing in on TB this whole time, we can't forget this is a family of killers. The other infamous member, M. lepra, uses that same waxy armor to cause leprosy, another chronic, disfiguring disease that has plagued humanity for just as long. It just proves how brutally effective this bacterial blueprint really is.
Which brings us right back around and leaves us with this one absolutely critical question. We understand the villain. We know its armor, its weapons, its strategy. But in this ancient war between us and them, evolution is the ultimate arms dealer. The real question is, can our science outpace its survival?